Medicare supplements are decades older than Medicare Advantage and Medicare Part D plans. Because of that, Medicare supplements, which are also known as Medigap plans, have different rules and laws that govern them. One unique feature for Medicare Supplement enrollment is the Medicare Supplement open enrollment period. This is not an annual enrollment period, and your Medicare Supplement open enrollment period is uniquely timed to you. In this video, I'm going to explain what the Medicare Supplement open enrollment period is, why it's important, and let you know what to do so you don't miss this enrollment period. What is the Medicare Supplement open enrollment period? Your Medicare Supplement open enrollment period is a once-in-a-lifetime chance to enroll in any Medicare Supplement plan sold in your state without having to answer health questions, provide a list of medications, or go through underwriting. During this period, insurance companies can't delay coverage for pre-existing conditions, and they also can't charge you more based on factors like tobacco use. The Medicare Supplement open enrollment period is 6 months long. It starts the first day that you meet both of these qualifications. You need to be age 65 or older, and you need to be covered by Medicare Part B. That's how Medicare wrote the rule. The age 65 part needs a little bit of definition. If you are enrolling in Medicare Part B with an effective date of the first day of the month of your Medicare eligibility due to turning 65 soon, you are considered 65 for the purposes of this enrollment period, even though you haven't actually had your 65th birthday yet. Let's look at a couple examples. If your 65th birthday is June 22nd, your Medicare Part B coverage will start on June 1st. And your Medicare Supplement open enrollment period will start on June 1st and run through November 30th. If your birthday is September 1st, your Medicare Part B coverage will start on August 1st. Because first day of the month birthdays are handled differently by Medicare, your Medicare Supplement open enrollment period will start on August 1st and run through January 31st. One important note. You do not need to wait to apply for a Medicare supplement until your Medicare Supplement open enrollment period begins. You can apply for a Medicare supplement months before your Medicare Supplement open enrollment period officially begins. Many of our clients apply for a Medicare supplement if that's their chosen coverage as soon as their Medicare ID number has been assigned. Your Medicare supplement will then be effective the first day of your Medicare Part B coverage. What if you had Medicare before age 65 due to a disability? When you first become eligible for Medicare due to a disability, you have a 6-month Medicare supplement open enrollment period. But in some states, insurance companies are not required to offer all of the Medicare supplement plans that they sell to people who are under age 65. Because of that, when you turn 65, you will have your 6-month Medicare Supplement open enrollment period with all plans available from all carriers. This is really good news for anyone who has been paying the much higher premium prices for under age 65 Medicare Supplement policies. When you turn 65, your Medicare Supplement premiums go way down. What if you kept working past age 65, stayed on your employer group health plan, and delayed your Medicare Part B enrollment until you retired? It's still the same rule. When you apply for Medicare Part B, that triggers your Medicare Supplement open enrollment period. You were 65 or older, but you didn't have Part B yet. As soon as both qualifications are met, you get your Medicare Supplement open enrollment period. Protecting your Medicare Supplement open enrollment period is one of the reasons why it is so important to delay Medicare Part B if you are going to continue working and remain on your employer's group health plan. More information on that is in the video linked above. If you keep working, stay on your employer's group health plan, but you take Medicare Parts A and B when you turn 65, the first 6 months that you are on Part B are still your Medicare Supplement open enrollment period. If you don't use that enrollment period because you were on a group health plan, you're out of luck. You do not get another Medicare Supplement open enrollment period when you retire. This is once in a lifetime. When it's gone, it's permanently gone. Is this the only time you can buy a Medigap plan? No, Medicare Supplements are month-to-month contracts that, at least in theory, you can change any time during the calendar year. In many cases, if you are 65 or older and beyond your first 6 months on Medicare Part B, you will have to answer health questions, provide a list of medications, and go through underwriting to be approved to purchase a new policy. The video linked above explains that process in more detail and goes through which health conditions may be problematic for passing underwriting and purchasing a new Medicare supplement. There are many exceptions to that general rule. There are events and circumstances that can trigger guaranteed issue rights that allow you to purchase some Medicare supplements without having to go through health questions or underwriting. A link to a complete list of guaranteed issue right situations is in the description to this video. One thing to keep in mind is a national guaranteed issue right does not give you the right to purchase any Medicare supplement sold in your state. A national guaranteed issue right gives you the right to purchase one of a partial list of Medigap plans. The two glaring omissions in that list are Plan N and High Deductible Plan G. Those are two popular plans that, as of the date of this video, you cannot purchase using a national guaranteed issue right. Different states have their own Medicare Supplement enrollment rules. There's a ton of variety from one state to another. You may be able to purchase a Medicare Supplement without health questions anytime during the year, or during a limited time around your birthday, or some other time during the year. Check your state's Department of Insurance website to find out what's available in your state. What about Medicare Supplements during the annual enrollment period? The ads are confusing every single year. Between October 15th and December 7th, you can change or join Medicare Advantage and Medicare Part D plans. You can leave your Medicare Supplement to join a Medicare Advantage plan, but unless you have a guaranteed issue right, you do not have a right to purchase a Medicare Supplement without answering health questions during the AEP. What if you miss your Medicare Supplement open enrollment period and can't qualify to purchase a Medigap plan through underwriting? If that happens, a person can enroll in a Medicare Advantage plan. Although that may not be the coverage that the individual preferred, sometimes there really are no other options. Unfortunately, Medicare does not notify you that you have enrollment periods coming up or that they are ending soon. It's all on you, the consumer, to remember all of this. Of course, you don't have to do that alone because we are here to help you. If you aren't sure what your enrollment periods are, or if you're worried that you're going to miss an enrollment period, you can give us a call anytime at 877-312-1414, and we can go through what enrollment periods are available to you so that you don't miss opportunities to enroll in health coverage for Medicare. Is your Medicare Supplement open enrollment period the best time to purchase a Medigap plan? It's the easiest time to purchase a Medicare Supplement, but I wouldn't say it's the best. Saying it's the best time to purchase a Medicare Supplement is used in marketing a lot. And that contributes to people thinking that once they've purchased a Medicare Supplement during their Medicare Supplement open enrollment period, that they can never change it. And that's generally not true. Medicare Supplement rates change every year. Your health can change. The best time to buy a Medicare Supplement is when you need to buy one. Whenever that time is, we will help you find Medicare Supplement coverage that is affordable and that you can qualify to purchase if at all possible. If you have Medicare Supplement questions, please feel free to give our office a call at 877-312-1414 or reserve a free, no obligation Medicare plan consultation using the link in the description. We're here to take the stress and confusion out of Medicare and help you find the best possible coverage for you. Have a great day.